Hi, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips to help prevent and treat marijuana use. Tip number 1 is, first of all, understand the physical health problems that are caused by marijuana use. Let's start with lung problems. Marijuana smoke has 3 times the amount of tar of tobacco smoke and 50% more of the agents that cause cancer than a cigarette. When lung function testing is done, pulmonary vital capacity, which is the ability of the lungs to take in oxygen, is decreased in people who use marijuana regularly. Also, the diffusing capacity of the lung, or the lung's ability to transfer oxygen into blood, is decreased in individuals who smoke tobacco and marijuana compared to just individuals who smoke tobacco. So the additional effect of marijuana is to decrease the ability of the lung to absorb oxygen into the bloodstream. Marijuana also causes an irritation to the lungs, which can often lead to a dry cough, can lead to wheezing, bronchitis, as well as can trigger asthma exacerbations in people with underlying asthma. In addition to lung problems, marijuana use can affect the heart. Marijuana use causes an increased heart rate as well as an increased cardiac output, which is the amount of blood your heart pushes out. Marijuana can cause angina, which is chest pain that's caused by not enough oxygen getting to your heart. And it can cause, especially in people with heart disease. And among people who use marijuana and have a heart attack, it's 5 times more likely to occur. A heart attack is 5 times more likely to occur within the first hour after marijuana use in people with. In marijuana smokers who have a heart attack, they're 5 times more likely to have that heart attack within an hour of smoking marijuana. Schizophrenia, marijuana use can trigger psychosis or psychotic episodes. Tip number 3, understand the societal or the impact on your interactions with other people that marijuana use can cause. So marijuana use decreases your reaction time and impairs attention, concentration, short-term memory, and risk assessment. So you're more likely to make bad decisions. And drivers are up to 7 times more likely to get into accidents when they're smoking marijuana than when they're not. Regular users are 4 times more likely to commit crimes in general. That's probably because of their decreased ability to make good decisions and their decreased ability to understand risks compared to non-marijuana users. Tip number 4. So we've talked about tip number 1 was the physical health problems. Tip number 2 was the mental health problems. Tip number 3 was the societal and criminal possible impact of marijuana use. Tip number 4 is that marijuana use can be considered a gateway drug in addition to alcohol and tobacco, meaning that marijuana users are more likely to become users of other illegal drugs such as cocaine, stimulants, hallucinogens, opioids, and sedatives. Tip number 5. So we've covered mental, physical, societal problems. We've covered that marijuana can lead to use of other drugs. Tip number 5 is that it can impact your motivation and ultimately lead to being less successful in life. So marijuana use is responsible for what's called the amotivational syndrome. It impairs occupational functioning, increases teenagers' risks of dropping out of school, and adults' risks of being unemployed. Regular users are less likely to graduate from college and are less likely to earn more than $30,000 a year. So in other words, people who smoke marijuana regularly are less likely to earn $30,000 or more a year. So we've talked about all the problems and the risks associated with marijuana use. Tip number 6 is what you can do to prevent it or treat it. So if you suspect if you're a parent or you care for someone who smokes marijuana, it's important to talk about it openly and identify the problem and discuss the risks that I've described above.